This presentation is going to be about what's been happening over the last 6 months plus or so with the coronavirus. And as a sociologist, one of the core areas in our discipline is thinking about social inequalities along various dimensions. So whether it's along the lines of sex and gender, race and ethnicity, or social class, those are really the big three. And those will be the ones I consider in my discussion here. And thinking about these inequalities, both in terms of the health outcomes from the coronavirus, as well as some of the economic impacts of the coronavirus too. Let me start off by talking about some of the health consequences. Now, a lot of things I'm going to be discussing, if you've been paying attention to the news with any regularity over the last 6 months, some of this stuff will be information you've heard of before, but what I've tried to do is kind of consolidate a lot of the trends that have been discussed in the media, and also kind of imbue it with a sociological perspective, because unfortunately, a lot of the things that we've seen in America as far as the health and economic consequences, to the majority of sociologists, they aren't very surprising, unfortunately. So thinking about the health consequences, maybe one of the most prominent pieces of news, and actually kind of right from the outset when COVID-19 started kind of rearing its ugly head back in like March and April, was thinking about the disparate impact among different racial and ethnic groups in the United States. So, and really the major finding, and once again, this is something that was noticed very early on, was that not all racial and ethnic groups are equally susceptible to it in terms of either contracting COVID-19 or obviously more seriously, losing their life to it. And there's plenty of data that's been collected and that's been disseminated by researchers that reinforces what we're talking about here. This is something I found. This was from the New York Times from sometime this summer. And just a very kind of quick way to look at in terms of the rates in terms of who has tested positive for coronavirus, or the number of diagnosed cases. So for every 10,000 people, the first thing up here is showing it on a nationwide level. So this is circa, what day is this? July 5th in the United States. And, I have to imagine things haven't changed that much in the last couple of months. But, when you adjust for population size, I mean, if you look at like the total, in absolute terms, the total number of cases, I'm pretty sure you're going to see whites have the most cases, because whites are the largest group in the population. But when you adjust for population size, then we're going to see these differences. So the overall total is that circa early July, for every 10,000 Americans, 38 had contracted COVID-19. But you could see very clearly here that among whites, the rate was significantly lower. And for African Americans and Latinos, it's commensurately higher. So the way to interpret numbers like this, especially when you're looking at rates, is that, okay, we compare the Black rate of 62 to the white rate of 23. And, in absolute numbers, 62 out of 10,000 or 73 out of 10,000 doesn't seem like a lot. But when we make these relative comparisons, that's when we see these meaningful differences, because what we can effectively say is that the Black rate is almost 3 times higher than the white rate, and the Latino rate is certainly 3 times higher than the white rate. So what we could effectively say, just looking at something simply like this, is that African Americans, Hispanics, Latinos, on average, are 3 times more likely to contract the virus than whites are. And this same New York Times article I was drawing this information from, they actually had a really good map that what you were able to do is kind of look at the United States on a county by county level, and assuming the county collected data on this or had data available on it, what you could see is the caseload in the county by total, and also seeing the sort of breakdown by race and ethnicity. So as of early July, we had about just over 6,500 cases in the county. But I mean, you look at here in DuPage, I mean, the differences are even more pronounced. So the white rate is actually a bit higher than the nationwide total. And same for the Black and Hispanic rate. But what you see very clearly is that the Hispanic rate, I mean, it's markedly higher. I mean, it's twice as high as the national rate. And, you know, once again, making these relative comparisons, what we could say is that, say, the average Hispanic Latino resident of DuPage County is 5 times more likely to have contracted COVID-19 than the average white resident is. And if you know, I don't know if any of you have, perhaps some of you have seen the DuPage County data that's available. I mean, one really useful piece of information that they've had available is a map that they update, I think, daily in terms of the coronavirus case count in the county. And they have it town by town, village by village. And so, you know, if you want to see what the total caseload is in Wheaton, you can find out. If you look at, you know, in Glen Ellen, where I live, you can find out. But one thing that has kind of developed over the months is that, sure, if you look at a city like Naperville, they're going to have a high number of cases because, you know, Naperville is going to be the biggest city in DuPage County. But in relative terms, where you see the really high case counts are in those communities in DuPage County that have relatively high Hispanic Latino populations. So if you look at the case counts in Addison or West Chicago, they're going to be markedly higher than what you find, say, in a Downers Grove or Wheaton or Glen Ellen, something like that. And there's all kinds of data that show, you know, this unequal impact along racial ethnic lines. This is something I can remember reading in The Economist shortly after things started to develop. Just looking at the city of Chicago itself, demographically, you may not realize this, but Chicago is very interesting demographically. I mean, for a number of reasons. But one thing about Chicago's population is that it's roughly divided into thirds. It's roughly 1/3 white, 1/3 African American, 1/3 Hispanic Latino. But the fatality total in Chicago as of mid-April, at that point, there were 5 times more African American deaths due to COVID-19 than there were white deaths. So another example of seeing this kind of unequal, disproportionate impacts in this case, among African Americans, but you're also seeing it, you know, among Hispanics too, nationwide. Now, one thing that the media coverage, you know, does quite well is kind of illustrate these inequalities, but I would argue that they don't always kind of talk about why this is. I mean, a lot of it obviously stems from, well, let me put it this way. I mean, if you just look at it at face value, somebody might assume, oh, well, what is it about the Hispanic community? What is it about the African American community that makes them more susceptible to COVID-19? And one thing that sociologists, at least I as a sociologist, would argue is that really when you try to kind of answer this question about why certain racial ethnic groups have been more heavily hit, is that it's not necessarily because of race or ethnicity, it's because of social class. In other words, when you see these numbers in terms of these really kind of unequal case counts and also deaths from the coronavirus along racial and ethnic lines, arguably it's not really a race story as much as it is kind of an economic story or a social class story. So for those of you who maybe haven't had that much kind of exposure to sociology, when we talk about social class in the discipline, what we're talking about are any number of factors, things like income, wealth, education, occupation. And social class is thought to be kind of a proxy or an indicator for all these different things in terms of our position in society. So one thing that the data that's been collected also points to, and as we're going to see in a sec, this doesn't contradict what the race and ethnicity numbers tell, is that rates for COVID-19 are also not equally distributed along kind of socioeconomic lines, that among poor Americans or the poorer Americans in our population, they are going to be at higher risk of contracting COVID-19. And you have to assume it as well as losing their life to it as well. And the argument that can be made is that as opposed to kind of looking at race or ethnicity being this really strong predictor of coming down, being diagnosed with COVID-19 and losing your life to it, even though it is, arguably social class is a stronger predictor. And the reason why is that, and this is something that sociologists have identified for decades now, is that in the United States, as I kind of indicate on this bullet point here, race and ethnicity and class are highly correlated. And what I mean by that is that somebody's skin color, somebody's ethnicity also tends to coincide quite often, unfortunately sometimes, with their socioeconomic position. And what I mean by this is that some racial ethnic groups on average are higher social class. They tend to be better educated. They tend to be richer and wealthier. Whereas other racial ethnic groups on average tend to be poor and less educated and things like that. Let me show you let me show you a chart. And one of the classes I teach at the College of DuPage is a class called Social Problems. So obviously, what's been going on has been very timely in terms of the impact of COVID-19. And the textbook I use has this nice table. And I actually was talking about this with my students just the other day, because we're on our chapter in the course talking about racial ethnic inequalities. And I like this table because what it shows is it's basically evidence of what I was just mentioning about how race/ethnicity and social class are highly correlated in the United States. And you look at these various indicators like median household income, college education, poverty rates. And you see, I mean, you don't need to be a rocket scientist to clearly see some of these differences by different racial ethnic groups. So, I mean, you look at median household income. So when we're saying median household income, this is just another way of saying the average household income. It's not the arithmetic average. It's the idea is that if you took all Americans, their household income, you ranked them from lowest to highest, the household that was in the middle would be the median. And so the average Asian or Asian American household in the United States, you could see is quite well off. I mean, average white household is also doing fairly well, but you see a pretty yawning gap between the average Asian or white household in terms of income versus the average Latinx, African American, or even Native American household. Same thing along educational lines. The average, I mean, the majority of Asian American adults in the United States have at least a bachelor's degree. The numbers are fairly high for whites. It's about close to the national average. About 1/3 of adults have at least a bachelor's degree. But you see these numbers are relatively lower for the other groups. Poverty rates, the same sort of thing. The poverty rate, you've got about 10%, slightly less than that, poverty rates for whites and Asian Americans. But you've got Hispanics, African Americans, Native Americans, roughly twice as likely to be poor than the average white or Asian American is. Infant mortality data here as well. So going back to what I was saying a few minutes ago about race or ethnicity, the point I want to kind of promote that maybe you don't see so much in these kind of media accounts of the racial ethnic differences in COVID-19 is that, sure, you do see these differences, and I don't want to deny that these differences exist. I mean, they do exist. I mean, there's no denying it based on the data. But arguably, it's not so much, a race or ethnicity story as much as it is a social class story or a poverty story. Because irrespective of race, one thing we've seen, as I said before, is that the poor are going to be more susceptible to contracting the virus. And, one of the things that sociologists have pointed out for some time now is, one reason why this is unfortunately relatively predictable is that the poor in America tend to be in worse health regardless. So, I mean, you look at kind of the sociology of health and illness in America, and maybe no surprise, health is not equally distributed in the US population among social class lines. So the wealthier you are, the more educated you are, you're probably going to be healthier, and you're probably going to live longer than somebody who has less education, somebody who has lower income. And so, I mean, among all these different indicators, so in terms of like life expectancy, body mass index, smoking rates, things like that, you do see these social class differences. One thing that I guess that has been discussed in the media, especially as the pandemic has kind of spread from hitting a lot of the elderly population to younger people, is that among younger people, those with certain pre-existing conditions are thought to be, not necessarily so they're going to be more susceptible to it, but if they do contract the virus, they're going to have more difficulty with it. They're going to be more likely to need to be hospitalized and more likely to lose their life to it. And I guess some of the things that have been discussed is that, folks who smoke, that's a pre-existing condition. So if you smoke, you've got your damaged lungs, that's not something that's going to be beneficial for you if you contract the coronavirus. Also, those who are obese, I guess, are more likely to, once again, get hospitalized, lose their life. And so these kinds of things, I mean, so smoking rates, obesity levels, these are going to be higher among the poor in America. And so it's going to be these sort of health-related factors. That's one reason why they're going to be more susceptible to getting the coronavirus, and you have these unequal impacts. And, I want to be clear, I mean, because, it's easy to say, oh, well, it's the poor are more likely to get this because it's their own fault. They're not taking care of themselves. They don't eat well. They're out of shape. They smoke. And in sociology, what we try to guard against is a sort of blaming the victim sort of ideology, which, politically, some people tend to lean on in terms of trying to explain away various issues. But in sociology, what we try to do is explain why, say, the poor are in the situation they're in, not because of their individual choices or behaviors so much as the kind of social structural constraints they face in their lives. So, I mean, an example of this is what I'm talking about in terms of like, health insurance. Um, One thing you may not know is that the United States, we are the only rich developed country in the world that does not guarantee health insurance as a right to its citizens. In the United States, health insurance is considered not a fundamental right. It's considered a market good. And, for those of us who are fortunate enough to have health insurance, we primarily get it through our employer. Um, it's something not to take for granted, obviously. But you think about the poor, you think about those who maybe work in jobs that do not provide health insurance coverage, or you think about, even more so, those folks who aren't working and they lack health insurance coverage. They may have some form, they may have like Medicaid coverage, something like that, but um, but lacking health insurance. Um, if you live in a community that lacks quality medical care, so I mean, if you maybe remember from kind of the first months of COVID-19, where was the coronavirus really hard hitting? I mean, it's hitting these major cities. And New York City was hit really hard. You had it here in Chicago too. But the thing about, so many of the victims in those situations is they were, the communities they were in, they're quite often poor individuals. And the medical care they were getting was at these maybe not as high quality kind of public inner city hospitals. And, and that's not to say that they're bad hospitals by any means, but relatively speaking, I mean, you look at kind of the metrics in terms of like, where you find higher quality hospitals. I mean, sure, you'll find some in the city, but maybe not where a lot of, poor residents live. And, the higher quality hospitals are going to be inaccessible to them for various reasons. So that's another thing. A lack of health insurance, a lack of quality medical access. And it's one of those things where, I mean, a lot of the media reports talked about, those who maybe didn't have health insurance coverage and they started developing symptoms of COVID-19 and they were hesitant to maybe get tested. They were hesitant to maybe go to the hospital. And, for some of these people, when they finally did go to the hospital, it was too late. I mean, their symptoms were so severe and the doctors and medical staff really couldn't do much for them at that point. Whereas if you have health insurance, you you should ideally feel more, don't have that hesitancy to go to the hospital, to contact your doctor if you're experiencing symptoms maybe earlier on, and it's something that can be dealt with in a more effective way earlier than later. Another kind of explanation for why we see these differences and how kind of social class leads to these inequalities is think about, the remedy that's been given, short of a vaccine for us in terms of kind of, protecting our health and trying to kind of minimize our odds of contracting the coronavirus. And so what are we supposed to do? We're supposed to socially distance, right? So whether it's when we're out in public, being 6 feet away from another person, but also, if you remember, back in mid to late March, in a pretty abrupt manner, we had the shelter in place orders, right? And, we were kind of on lockdown for the end of March through April, May, things started to open up a bit. But, this is another thing that's not distributed equally. I mean, the ability to kind of self-isolate. Some of us have more of an ability to do so than others. And so you can think about this, in a number of different ways. You think about this in terms of simply sheer physical space. So what if you are maybe not as affluent and, you live in a small apartment and you share it with, 4 or 5 other family members and you've only got maybe a couple bedrooms. And the idea is that if one person gets sick, one person tries to kind of, self-isolate and quarantine themselves, it's going to be difficult in such a small, confined space. Whereas if you have, a larger home, you could stick somebody in a basement, for instance. I shouldn't joke about it. I mean, this is serious stuff. But I mean, the point is that for the poor, for the less well-off, that lack of physical space can be critical, because what has happened is people have contracted the virus and they spread it to their family members, because viruses like this, they thrive on proximity. And if people are just going to be close to one another, in terms of this physical space, that's going to make the spread of the virus that much more feasible. And also, I mean, you think about kind of the major adaptation that we've seen for so many of us in terms of our jobs. I mean, certainly for me as a professor, the last time I was in a classroom was mid-March. And at this point, it's probably going to be at least another year before I'm in a physical classroom again in front of students. But fortunately, because of technology, I'm able to work from home. I mean, I've been able to kind of teach my classes virtually like this, via Zoom and other, in other manners, whether it's via Zoom or just doing regular online classes. But this is, once again, another thing that's not equally distributed in our population. Not everybody has the ability to work from home. So if you are in a fortunate position, like somebody like I am is, and you don't have to go out and about, you don't have to physically go somewhere for work, you can do your job from home. And especially during these first kind of critical months when the positivity rates were high, we're trying to kind of, we had the shelter in place order and things like that. Those of us who were able to work from home, we were in a much more privileged position than those who couldn't. And so you think about those who were kind of labeled as essential workers. And for many of them, they didn't have that ability. I mean, they had to kind of be out there and face to face and, be in physical proximity with others. And you think of, obviously, kind of, people on the front lines in terms of doctors and nurses and medical staff. I mean, they're going to be at the very front lines. But, you think about folks who lack the ability to work from home. And many of them are going to be in kind of things like in retail, so working in grocery stores. They might be working in restaurants, well, once the restaurants have opened up again. But, especially when we were kind of, sheltering in place, you think about delivery drivers for Uber Eats or something like that. And this is another thing. I mean, you see a pretty clear relationship in terms of income, education level, and the ability to work from home. Those folks who are kind of in, things like professional positions like I am, I'm once again fortunate enough to be able to work from home. But for many people, they're in jobs that's simply not a viable option. And they have been more at risk of contracting the virus because of that.
Hey, Matt, we have a question related to what you're talking about, asking, do you think that the high rates, like you said, are due to the group's line of work? For example, West Chicago has a more industrial base than Wheaton or Naperville, for instance.
Sure, I think that's no coincidence. Yeah, I mean, you look at, if you drive through in Addison or West Chicago, yeah, there's a lot of kind of manufacturing, there's like warehouses and things like that. And so, I mean, I think that's going to be another explanation for it. I mean, the industrial mix there is going to be different than it is in a Wheaton or a Glen Ellen or a Naperville. And so these are going to be folks who they're still working on a face-to-face basis. And because of that, they're going to be more prone to get the virus. So, I mean, that in addition just to the, the racial ethnic demographic factors, because that's another thing. I mean, Hispanic, Latinos, and African Americans, they're more likely to be working in these sort of, essential occupations where they're going to be more at risk for contracting the virus.
Thank you.
Sure, that's a good question. Okay, now shifting gears here, I mean, there's a lot to kind of consider here, and once again, this is really what's maybe gotten most of the kind of coverage in the news about COVID-19. But, you know, as significant as kind of the health impact of COVID-19 has been, we also can't deny the economic consequences. And it's really been staggering. If we were to go back in time to January and just, I mean, not, obviously we couldn't really imagine, you know, going through this pandemic and, you know, just how historic it's been. But the economic impact has, I mean, it's difficult to overstate how significant it's been. I mean, you know, it was looking really scary back in March and April when, you know, we had all these mass job losses and, you know, just historic, the numbers and how they were. And I mean, we're not out of the woods yet by any means, but in terms of the economic impact, I mean, we're talking about the scale like the Great Depression back in the 1920s and 1930s in terms of job losses and things like that. And so what I also wanted to talk about here is how the economic consequences of the coronavirus, just like the health consequences, they haven't been equally experienced or equally distributed within the population. Now, one thing you might be wondering is why I didn't talk about sex or gender in terms of the health consequences. Now, I didn't just skip that really fast. I mean, the reason I didn't talk about it then is because as far as I'm concerned, there isn't that much to talk about. The only thing that I was tempted to mention was that I guess there has been some evidence that men, if they come down with COVID-19, they're more likely to lose their life to it. So I guess there has been, and I mean, we saw this like in Italy when they were first hit by it. We've seen it here. And, you know, medical researchers are still trying to figure out why. That has been one thing. And so, you know, there has been, I guess, a somewhat slightly different sex and gender impact in terms of health consequences. But the one thing I wanted to mention here in terms of kind of the gender impact has been kind of economic consequences. And one thing that's really been clear in all the millions of jobs that have been lost due to COVID-19 is that these job losses haven't been equally distributed by gender. Women have been harder hit by unemployment than men have. And this is a good graphic. I got this from the Pew Research Center's website. And it shows just how dramatic kind of the change has been, just going from like February to May, this sort of 3-month period. And so overall in February 2020, the unemployment rate for all workers was a shade under 4%, which if you know your unemployment rates, you know those numbers, that's very, very good. I mean, economically speaking, you know, we were in good shape pre-COVID-19, but obviously things changed pretty quickly in March and April. And so, you know, just after these shelter-in-place orders came about on a state-by-state level, I mean, there's mass hemorrhaging of jobs nationwide. So we went in a 3-month period from a really good 4% unemployment rate up to about 13%, and which is actually some economists I can remember reading were forecasting we're going to get up to like 20% unemployment rate, which is, you know, we're talking, you know, Depression era levels. But one thing we could, as I mentioned, there's a differential gender impact. So the unemployment rate went up for both men and women, obviously. And it went up significantly for men, don't get me wrong, but you can see that women actually, the female population actually had a lower unemployment rate than the male population. But it's actually a good 2+ percentage points higher as of May 2020 than it was for men. And it's also looking at some numbers from the Great Recession. So the last major economic downturn about a decade ago. And what's interesting about these numbers is that if you recall the Great Recession, is that, yeah, we had a lot of job losses. It wasn't near the kind of immediate scales what we've had here with COVID-19. But during the Great Recession, it was the opposite. Men had a much higher unemployment rate. And the thing is, there's nothing about like men or women. And it's not a random thing either. The reason why we've seen this kind of unequal impact for women due to COVID-19 has been because of the areas of the economy that have been hit due to these shutdowns. So many of the job losses due to COVID-19 have been in the leisure and hospitality industries. So you think about restaurants, you think about hotels, you think about the travel industry. You know, these are the aspects, the dimensions of the economy that have been really hammered. That wasn't so much the case 10 years ago. The areas of the economy that were hit with the Great Recession were things like manufacturing and construction, where the workers were disproportionately male. Whereas this time around, the sectors of the economy that have been harder hit are disproportionately female. So that's why we're seeing this unequal impact in terms of, you know, unemployment rates and job losses. Women have been hit harder than men this time around. Along racial ethnic lines, just like the health impacts, we're seeing different economic impacts too, which should be no surprise. One thing I wanted to show you here is I found some good data that's been collected by researchers, just survey data. And what it shows is, and this is something that I think the news has been, and you know, the media has been documenting pretty well, is like the economic insecurity so many of us are experiencing, so many Americans are experiencing because of what's happened due to COVID-19. And so many Americans are struggling financially, but this is one of those things that is just like anything in society. You're probably going to see inequalities along racial ethnic lines. So this is from the Washington Post from this summer, June 4th. So this is just from actually the Census Bureau. They're actually doing they did these temporary surveys for a short time when the coronavirus hit. So they were able to generate this really good data about the kind of economic impact of COVID-19. And so they asked Americans questions, you know, in the survey about shortages of food, income loss, missing a mortgage or a rent payment, not having insurance, and I assume they're referring to health insurance. But you know, these issues like food insecurity, not equally distributed. I mean, this is kind of predictable based upon some of these numbers I was showing everybody earlier. Lost income. I mean, everybody's lost income, for the most part. So, but you know, Hispanics and Blacks are slightly more likely to have done so. Missing a mortgage payment. You definitely see for African Americans, it's going to be quite a bit higher than it is for other groups. Missing a rent payment along the same lines, not having insurance. And so you think about things like any of these things, like housing insecurity, the ability to, you know, being able to pay your mortgage or to pay your rent. And this is one of these things that, you know, due to, you know, government intervention, you know, a lot of people had kind of rent protection, a lot of, I guess, mortgage providers, you know, they're providing these kind of mortgage, I want to say holidays, but I mean, basically giving so many, you know, mortgage recipients kind of a break because of, you know, job losses and things like that. But, you know, as these kind of, you know, this kind of understanding sort of break for folks and this assistance in terms of not, you know, not having to worry about like making a rent payment or a mortgage payment. As these expire, we're going to see, and this is something that's happening as we speak probably, in recent weeks or even the last month or so, is you're going to see this uptick in evictions. Renters not able to pay rent, people being foreclosed upon because they can't make their mortgage payments and things like that. This is a good example of how by no means are we out of the woods yet in terms of the economic impact of coronavirus. And last but not least, I mean, just like I was saying, social class is a major kind of dimension of the inequalities along health lines. We could definitely see the same thing in terms of the economic impacts. And a couple of things I wanted to mention here, and this is the last thing I have to kind of wrap up the presentation, is some economists, policymakers were hoping that back in March and April we had the kind of shelter-in-place orders, and that once those dissipated, businesses could open up again. We could go out shopping, we could go out to eat, we could go out to movies, and we'd see what they were terming like a U-shaped recovery. If you like graph the kind of the pattern of economic activity, a U shape or a V shape. So going sharply down, then sharply back up again. But what some have been arguing is that what is developing now is not this sort of kind of dip, then uniform rise again, but actually more of a K-shaped, where we've had this dip, but we've got two different recovery paths. One path is those folks who are better off in our society, and economically, they're recovering nicely over the last few months. But the other chunk of the population, they're not doing anywhere near as good in terms of their kind of financial situation. And this is one of the things about COVID-19. I remember reading this somewhere, is that, the impact of COVID-19 is that it hasn't, the impact of it, not much of it has been really novel or a surprise. And I mean, don't get me wrong. I mean, this has obviously been a new experience for all of us. But the argument is that a lot of this stuff could be predicted. But the argument that what I was reading was that, these patterns we're seeing, they're not new, but COVID-19 has accelerated or accentuated these patterns or these trends. So, I mean, one way of thinking about this is that America, even before COVID-19, we were growing more and more unequal over time. The rich were getting richer, the poor were getting poorer. A lot of Americans were just kind of, treading water, staying afloat. But the arguments that some have been making is that COVID-19 is accelerating these trends, and that those who are well off, they're doing just fine, but those who are less well off, they're struggling even more than they were before. And so you look at some of the evidence for this. I mean, you look at folks who are going to be in the upper middle to upper classes in society. Their 401ks, their investments, their mutual funds, they've been doing fine. I mean, there was a slight dip, back in March or April. But, despite the unemployment numbers, despite, all the other kind of economic indicators, the stock market led by, the tech companies, the numbers continue to go up. And so for those, for many of the wealthiest people in our society, I mean, their wealth comes from investments. And, people like, Jeff Bezos, I mean, I don't know how much his fortune has gone up, in the last 6 months. But, companies like Amazon and Apple and Zoom, their valuation has just exploded. I mean, because of COVID-19. And so the rich, as far as investors and things like that, they're doing okay. I guess one thing that's been happening is a lot of people have been saving money more than ever before. And, if you've gotten money to save, And the argument is that, people aren't spending as much as they used to. Because why? They couldn't travel this summer. I mean, they couldn't like fly overseas. They're not going out to the movies. They're not, going out to restaurants as much as they used to, things like that. And so for many of the well-off, the argument has been that the pandemic has been more of a nuisance or an inconvenience than anything else. Yeah, it's a pain in the butt that, my kids can't go to school face to face. Yeah, it's a pain in the butt that I got to wear a mask when I go out. But in terms of like, the real harsh impact of COVID-19, for many privileged Americans, it's been more of an inconvenience than anything else. But for, many of the less well-off in our society, it's a different story. So for those who are poor or near poor, entirely different chain of events. And, despite what the unemployment rate is, the unemployment rate, I was showing these numbers before, you know, when you see these numbers, that doesn't mean 13% of the population is lacking a job. What the unemployment rate doesn't account for is people who can work, but they stop looking for work because they've been frustrated. And so, according to some estimates, you got maybe about a fifth of the workforce. They can work, they could work if they wanted to, or if they could find a job, but they're not. And so you have many more people who've lost their jobs and want to work, but they can't because of COVID-19. And many of them are going to be these folks in industries like hospitality and leisure, in the service sector, that, these jobs, they're simply not going to be coming back in major numbers anytime soon. Food insecurity. I mean, one of the most kind of vivid pictures of, what's happened with COVID-19, maybe some of you have seen these images of these lines at food banks nationwide. And just, it's just staggering, the number of people who, and these are kind of pictures from like March or April. So shortly after, people were starting to lose their jobs. This was San Antonio. Just amazing mass of people who need assistance because they didn't have the ability to feed their family. And so, the people who are going to food banks, who are relying on charitable organizations, who are experiencing food insecurity, those numbers have unfortunately skyrocketed too. And, one saving grace, that came out of Washington was the CARES Act. So that was the one-time stimulus most Americans got, the $1,200, and plus the $600 per week top off of unemployment insurance. But the thing is that stimulus is a one-time thing. The unemployment benefit expired at the end of July, and that hasn't been renewed. So you've got all these people who are receiving unemployment, but they're not receiving that extra benefit that really helped them get through the early months of the coronavirus. And so it was good, but definitely some more help at the federal level is needed. And unfortunately, for the time being, doesn't look like it's forthcoming. Okay, that's all I've got for everybody. Thank you for listening to my presentation. We've got a few minutes, so if there are any additional questions, I could address them now.
Thank you so much. Yep. If anyone has questions, throw them up there. Let's see, we have a question. Do you think women were also disproportionately affected economically due to having to pick up childcare responsibilities within their households?
Yeah, that's another thing. I didn't mention that, but you think about what happened when schools shut down. And if it's a situation, excuse me, whether it's a single parent, whether it's, there's other adults in the household. Unfortunately, when push comes to shove in many American families and somebody needs to watch the kids, it's quite often mom. And so, yes, definitely what's happened with many women is they were forced to maybe quit their jobs or maybe cut back their hours dramatically because, they needed to stay home with their kids because that's one of the functions of schooling that maybe many parents take for granted, is that schools are a place for us to basically warehouse our kids for 8 hours a day or so, 5 days a week. And, with schools closed like that, we don't have that benefit. And so somebody needs to watch the kids, somebody needs to school them, or at least help them with their homeschooling. So yeah, that's definitely had another kind of, that definitely explains another impact in terms of women being more likely to not be working this time around in terms of this economic downturn versus 10 years ago.
Yeah, and I know I've been reading that usually it's the mom, the wife that ends up quitting her job because she, statistically makes less money than her husband.
Yeah, and I mean, what some research points to too is that even in those households where mom is the breadwinner, you know, some men still have these traditional gender roles in their minds, unfortunately, and they'll still expect the wife to do the kind of traditional sort of stuff, even if she's the one who's bringing home the bacon, figuratively, you know.
Very true, very true. And another question, what do you think about the automotive sales and real estate market, since they seem to be doing okay? And what are your thoughts on these segments of the economy?
I think that's another indicator of this sort of K-shaped recovery because, I guess, some are predicting like the real estate market would tank because people are sheltering in place, they don't want to move. But, evidently, the housing market's doing relatively well. And those who have been like on the market or have been selling their own, they've been able to do so. I mean, it's certainly the fundamentals have changed. And then, for those who are kind of, shopping for cars, I mean, interest rates are really low now. So to be able to get a loan, I was reading something just the other day about, I guess, there's like a real shortage nationwide of like late model used cars because so many people maybe they relied on public transportation in the past. They're looking for a car now, especially people like in Chicago's and New York's and places like that. So yeah, I mean that's another kind of indicator, I think, of the kind of the inequalities in terms of the economic impact. I mean, yeah, I mean the real estate market, say like the auto industry is chugging along to a certain degree, but that's been fueled by the middle to upper classes who have been kind of relatively sheltered from the economic impact of the coronavirus, I would say.